joining this panel discussion, which is looking at a very, very large subject. The future of care in Scotland is the matter in hand. So let's go for it. Our panel here are each and all experts on social care in Scotland. They'll be sharing their thoughts with us briefly, and then it's over to us to respond, to ask questions, to explore what the future might look like. So we have, for instance, Shubhanna Hussain-Ahmed, who is Partnership Development Officer with the Coalition of Carers, a very important and often overlooked group of people. So welcome, Shubhanna. We also have Dr. Danielle Farrel, who is the Managing Director of Your Options Understood, which is known as YOU, the initials, Your Options Understood. She's a user of self-directed support and lives with cerebral palsy. And Danielle, very welcome to you. It would be great to hear your perspective on the issues under discussion. We also have Bill Alexander, who is an associate with Children in Scotland. He's Deputy Chief Social Work Advisor. He was Deputy Chief Social Work Advisor to the Scottish Government during COVID, I think. Please correct me if I'm getting anything wrong. 40 years as a professional in social work and social care, and he's a Director of Social Work at Highland Council. Please forgive me, Bill, if any of that is wrong. I'm happy to be heckled at any stage.
It's a few years since I was Director of Social Work, but I was Director of Social Work, Pennie.
Thank you so much. Great. We also have Annie Gunner-Logan, who's Director of the Coalition of Care and Support Providers in Scotland. And she serves on a number of Scottish Government advisory boards and is very, very active in helping to shape where we go from here. And then last, but by no means least, we have Dr. Donald Macaskill, who's Chief Executive of Scottish Care, an organisation that represents independent care providers in Scotland. He's an equality and human rights specialist, really, and specialises in equality and human rights for older people, social care and health. So we have a fantastic, hard-hitting lineup. Let's start, if we may. Shubhanna, are you happy to kick us off with your short presentation? Where do you stand on this title, The Future of Social Care?
Thank you, Pennie. Thank you also to the Alliance for inviting me along today. So in terms of, I suppose, my introductory piece, I wanted to say something about the impact of COVID for unpaid carers in Scotland. I also wanted to say something about the lessons that unpaid carers have learnt during this period, and perhaps at a later point in the discussion today, say something about what decision and policymakers have done to respond to the plight of unpaid carers. But for now, I'll stick to my 5 minutes and talk very much about the impact that COVID has had for unpaid carers. So during lockdown, we saw an additional 400,000 people across Scotland take on a caring role for a relative or a close friend, and that took the number of people who provide unpaid care in Scotland to around 1.1 million for the very first time. During lockdown, what we saw was literally overnight, all services for disabled children, adults, for people with mental health conditions, addictions, people with long-term health conditions, all of that closed down or was severely reduced. And what that meant in many instances was that it was left to people like myself and like all other unpaid carers across the country to pick up the pieces. We were left with not just the physical day-to-day caring on our own, but also left with the uncertainty of not knowing actually when any of these services or supports would resume again. And in many instances, many of us were left with very distraught family members who either didn't have the capacity or the level of understanding to know why they could no longer see their friends, do the activities that brought them so much joy, that they could no longer access their services or the supports that had become such a vital part of their daily routine. So I'm not sure how many folk already know this, but the majority of unpaid care in Scotland is provided by women like me, aged between 35 and 54. In fact, I think around about 46% of all unpaid care in Scotland is provided by that age group. And during lockdown, many of us, again, mainly women, were trying to balance that caring role alongside the challenges that came with home working, and for some of us, the challenges of also homeschooling and the added pressure of homeschooling a child with additional learning needs or a disability. And also the challenges of home entertaining the children in general, and adults as well in some instances. There was also the threat of redundancy that was looming over some of us, and some of us were also trying to sort out the practicalities of getting the shopping and sorting out the medications, trying to sort out the PPE, trying to get a social worker to return our calls or emails, or just trying to get in touch with, in fact, any support services for that matter. And all of that was just absolutely relentless. And I'll tell you something, I don't drink and I don't smoke, but I did get through a hell of a lot of cake during that period. And so as well as the physical and practical aspect of the caring role, there was also this mental energy that consumed you. It was that mental energy involved in constantly trying to be positive, trying to reassure those around you, but deep down absolutely stressing about, can I sustain this way of living and working? You know, constantly questioning yourself, am I doing enough? Am I doing enough to support the people who are relying on me to keep my head together? Am I doing enough as a mum? Am I doing enough to help my disabled husband to remain as independent as he was before lockdown and before we all had to go into shielding? Am I doing enough? Was I doing enough as a colleague, you know, as somebody who works for a national carer organisation, to ensure that the voices of unpaid carers are heard by policymakers during the pandemic? It was physically and mentally exhausting, and I think it's one of the things that none of us were quite prepared for at all. However, I think it's important to point out that it wasn't just middle-aged carers like myself who were impacted by that lockdown and COVID. It was carers from a range of other groups who were equally impacted, and I want to say something about young carers as well. So young carers were another group who were severely impacted by lockdown and COVID. Their role at home also increased overnight, particularly those who were the primary carers at home. So they were also now no longer getting any extra help at home. They were not getting a break from their caring. They were also worried about school, about college, about university, about exams, about future prospects. And you wonder, is it any wonder then that I think 69% of young carers and 76% of young adult carers in Scotland are now feeling more stressed since coronavirus? We also had older carers who again were left on their own to care for their spouses or for their grown-up disabled children. Many of them unable to take full advantage of some of the online and digital support that was being made available to other carers around the country. And we also had carers from ethnic minority communities who were now also further isolated because they were no longer able to attend any of their local faith and community groups. There was issues around the start of lockdown around information and guidance and shielding information not being made available in community languages. Initially, there was also shortages of interpreting services, particularly for the phone and online health consultations. We were also being told by the media that people of colour were more at risk of contracting the virus and dying from COVID, but apparently that was not the case in Scotland. So, but what did that even mean in practice? You know, should people of certain ethnic minority communities, should they have perhaps been advised to shield as well? There was very little tailored support for many of those communities who were deemed at risk, and that caused a huge amount of anxiety and distress, certainly among older relatives in my family. So coming back to what have we actually learned, or what have unpaid carers learned during this period of lockdown and COVID? And I think, as my time is running out, the short answer to that can probably be summed up in 3 points. I think unpaid carers have learned that they are not the equal partners in care that they were led to believe they were prior to COVID-19. Number two, they have learned that their concerns and their well-being is not a priority for decision makers. And number three, they have learned that they have very little control or power over the decisions that affect their lives and the lives of their loved ones as well. They've learned that they've got very few rights, and what rights they do have unfortunately just not been realised during lockdown and during this whole pandemic. And I think I'll leave it there for now and come back to discussion later.
Thank you so much. You've given us a lot of talking points there. Thank you. For our next kind of introduction to this subject, I'd like to introduce Dr. Danielle Farrel. Hi, Danielle.
I guess I'll start from my personal sort of experience and lead that up to why I sort of changed things for your options as a business. So I live independently, and I have done for the last almost 4 years. So when lockdown happened, my older brother said to me, picking up on some of the points that were just said, would you not be better going home to stay with Dad? And I said, well, no, because my dad is in that elderly age group, and for me, I felt if I'd gone home, that I would be putting him more at risk, because I would have had to have support coming into the house, and they're obviously going to other people. So from a personal point of view, I just felt that was not the right decision for myself or my dad. But that led to 10 weeks of not seeing my dad, which was the longest 10 weeks of my life. And my dad had to quickly learn how to use technology, because he doesn't do technology very well. So I could actually see him and have sort of that kind of connection with him still. I think for me, at the start of lockdown, I thought, oh my God, how am I going to manage however long this is in lockdown? But now as we're coming out of lockdown, I'm very aware now that I have started to go back out slowly. But I'm very aware of the fact that it's actually not bothering me. So I'm aware of the fact that it's where I used to go out socially, people used to say, oh, I was never in. But where now I'm like, right, it's not bothering me, but I know that, and I know that it's not a good place to be, because we can't keep living like that. So mentally, I think I need to push myself sometimes, because we're all saying we've lost a year of our life. Well, you're in danger of losing even more if you don't sort of acknowledge. Obviously, we need to keep ourselves safe, but at the same time, we can't keep living in a bubble. So you need to sort of balance what's right and what's right for you, because what's right for one person isn't going to be right for everybody. And I don't think there's any right or wrong answers to how you deal with that. On a sort of business level for Europe, understood, like many businesses, I didn't know what was going to happen. I was very uncertain about what was going to happen, but it's been an unexpected journey that I'm sort of embracing at the minute. I spent a lot of time at the start of lockdown doing a new website for Your Options Understood, and within that website I rebranded, and so there's a new logo, and it's very pink, and it's very me, and it represents you as well, because me is you, if that makes sense, because I use my experiences to help others. So a big part of that is been moving services online. So I'm working. Hopefully this will be live by the end of the month or the beginning of next month. I'm working on an e-learning resource so that organisations can purchase training modules for myself, for the staff, until such times as we can get back to a place where we can do it safely face to face. I also spent some time doing a person-centred plan for a young person who's moving down south. But again, that had to be done online because we couldn't do it face to face. So it's a bit, for me, it's been a very, very much a learning curve. And you said at the start, not everybody's confident with Zoom and all that. But I think for businesses like mine, I've had to very quickly become confident with it. And for me, Zoom fatigue is really a thing because I spend most of my days in this corner, and I actually do say to people, I do move from this corner. But you've had to sort of embrace that, and I also experienced a lot of assumptions during lockdown. It was assumed by somebody who used to support me through my business that I wouldn't be working anymore. And I really don't understand why this was told to me by another party who'd approached them on my behalf. I can only assume it's because of the shielding aspect that he just assumed that I wouldn't be working anymore. But for me, and I did say this to this person, then it's so apparent now how much disabled people and their carers, like you've said, family carers, need the support of businesses like mine more than ever, and that's why I've been so keen to rebrand and still be able to reach people. And I've had other organisations, such as In Control Scotland, come to me and ask me to do some work collaboratively with them in various areas because they've moved their service digitally. So it's about supporting them to still be able to deliver their services because it's new to everybody. But I guess for me, the biggest thing I've learned for myself and my business is that we can't go back to how it was before. I was quite fortunate in that on a personal level, my support at home, I use 3 different sources of support. So for personal care and sleepovers and things at home, it's one provider. For my work-related support, it's another provider. And I employ PAs for a certain aspect of my support. So I was quite fortunate in the sense that my support didn't get cut in any way yet, but I guess that could still happen with track and tracing. So I'm very conscious of that, but I'm also conscious of how it's been for other people. And I think some of the surveys that some of my partner organisations have done have shown that, because it's showing people being isolated, not being able to get shopping, and various factors. So I think it's important to say it can't go back to how it was before, although we dread to think that we might go back into another lockdown or another national lockdown, whether it be at this point or at some point in the future, because nobody knows what's going to happen. It can't be how it was before, because the disabled people and the carers can't live with that threat of, are we going to be forgotten about again? So I think, I'll just leave it there, and I hope that's enough points to be
I think so. There's a lot to talk about there. Thank you very much, Dr. Danielle Farrel. Now we have Bill Alexander. Hi, Bill.
Hello, Penny. Morning, everyone. Thank you to Shubhanna and Danielle for that. I'm not quite sure how the rest of us follow after that. I'm pleased to speak this morning, though, on behalf of the Chief Social Work Advisor's Office in the Scottish Government, and I'd like to start by paying tribute to the social work and the social care workforce who've risen, I think, to the challenge of the pandemic, continuing to support people and to deliver critical services, even when their own health might be at risk, even when it compromised many aspects of their personal and family lives. The challenges in adult social care are not about the people who deliver it, but about the system. And these challenges have existed for some time. They have simply been exacerbated, as we've heard from Shubhanna and Danielle, by the crisis. And it's that deeper challenge around the future of care that I want to focus on. All of us on this call, all 127 of us, remarkable, believe in social work and social care services. And as Ian Welsh said yesterday, that are resilient and proactive, that are person-centred, that start with prevention, that are asset-based, that promote human rights, co-production, and independent living. But too many of our services remain reactive and fragile, subject to increasing pressures, annual budget setting, and wearied by the impact of years of austerity. And while our workforce is highly skilled, it is low paid and insufficiently valued. And we will have an enormous recruitment and retention challenge in Brexit Britain. Furthermore, access to the support and services that people need and that we provide is often managed through reactive eligibility criteria, where we wait until someone's capacity and well-being has declined, and sometimes until they are in crisis, before we offer support, often then building dependence rather than independence. And we wait for further decline to take place before we review that support. It's almost a decade since publication of the Christie Report, which called for an asset-based preventative approach to avoid public services buckling under the strain of increased demand and austerity. But where is anticipatory care? What's happened to reablement? And where have we actually delivered the promise of self-directed support, not just for the few, but for the many? There are system issues getting in the way of what we are seeking to achieve. Integration was, of course, meant to fix this. And as social work and social care practitioners who have collaborated with fellow professionals throughout our working lives, we certainly understand the value of integration. But too often when we talk about health and social care, we are referring to an organisation or a structure and not to our practice. We are not describing the experience of frontline professionals, service users, or unpaid carers. Health and social work has to be more about the experience of the service user than the experience of the board member or chief officer. It has to be about the service users, hopefully, seamless engagement with the various professionals they encounter as their needs are being met. Importantly, it's about the role and responsibilities of those professionals fitting together. It's not about the nurse becoming a social worker, but about the nurse being the best possible nurse, the social worker being the best possible social worker, and then knowing when and how to engage with each other to achieve the best service and outcomes for the individuals they both care for. Where does someone go to ask for help? Not just the older person, but the person with worries about their mental health or a disability or who has a problem with drugs. Who gets to know them, understands their issues, and coordinates their assessment? Who contributes to that assessment? How do we get help quickly that maximizes someone's independence and personal coping skills? Who coordinates and monitors that support to adjust it as necessary in the days, weeks, or months to come? And do we even speak the same language across the professional disciplines? Do the terms assessment, anticipatory care, or care pathway mean the same thing to a clinician and a social worker, never mind to an unpaid carer or a service user? These are the sorts of questions we should be asking and answering in a truly integrated model of health and social care. The answer to these questions don't just exist in the world of social care, of course, they exist in the world of social work, which isn't a term we hear often enough when talking about social care. The answers lie in the role of social work and social workers to assess needs and to bring together a team around the person receiving our services, to support people to fulfill their potential by focusing on the outcomes they seek to achieve. And finally, I very much hope that is what the review of adult social care will focus on, outcomes. We need to reflect on inputs and outputs, of course, but critically, what are the outcomes we are seeking to achieve for the profession, for the people who use our services, and for our society?
Thank you very much. I'd love to get some responses to that, but let's first hear from Annie Gunner-Logan. Hi, Annie.
Hi, Penny. Thanks for that introduction. Thanks to the Alliance for the invitation. The brief that we've got here is to say what we've learned and what we can do about it. So I've got 5 points. The first one is, I think we have learned, again, how fantastically brilliant our third sector is, seriously, and we've learned how fantastically brilliant are the people who work in it and the people who volunteer for it. So while public authorities were busy removing people's support packages, withdrawing services and moving to protect itself, the third sector kept calm, carried on, finding alternative and innovative ways to maintain support for people. And we have seen the most extraordinary mobilization of voluntary sector and voluntary action. And already I'm seeing lots of earnest papers being circulated about how councils and other public bodies can build on this for the future. Well, guess what? It's not theirs to build on. Public procurement processes have successfully smothered wave after wave after wave of third sector action by turning it into contract opportunities and unsustainable 80-page tender specifications. And we just cannot let that continue. We have to go in totally the opposite direction. Real partnership, real collaboration, equal consideration, and access to resources based on a completely different set of criteria than we've been used to up to now. So what needs to change? We need to find the people who are delivering really good social care and support them to do more of it. I've always been absolutely astonished that the third sector only offers a third of about social care services, given that actually, objectively, we're pretty good at it and we offer the best value, but we're not the cheapest. And we're not in the enviable position of being both player and referee, like some of our public sector colleagues. So we need to change all of that. And we can start by finally taking self-directed support seriously. Because I think the third sector is pretty confident that if people were genuinely empowered to direct their own support, they'll find that the third sector is totally up for that. If only we didn't have to waste so much time tendering and retendering and retendering for the same old, same old. So that's my first point. My second point is that we have learned how very deeply some of our political and public service leaders have had their heads buried in the sand about the flaws in our system of social care. I've been absolutely amazed by how many senior figures have professed themselves shocked, for example, by the fact that care home workers are only entitled to statutory sick pay, when actually they have driven, they have legislated for, they've built, they've supported, and they've maintained the system in which there could have been no other foreseeable outcome. So some of the people who are shocked, who are now leading the charge for something new, when they had the option and the influence to do something about all of this, they didn't. So a degree of humility, in my view, is a prerequisite for anybody who enters this arena. It's never that satisfying to say, I told you so, but guess what? We told you so. So on the upside, there is some really good fresh thinking going on. Certainly amongst user and carer groups, certainly in the third sector. In CCPS, we've spent the last couple of months thrashing out some big ideas for change. Watch this space. We'll be ready to go with that very, very soon. And we're really, really keen to hear what people think. It's not a blueprint. We're not producing a blueprint, deliberately not. There is little point, in my view, in producing blueprints that only come from one perspective, because that is where we have repeatedly gone wrong. Collaboration is where it's at now, so we need to see more of that. Okay, number 3, we've learned the hard way, I think, how paper thin is the practical reality when the chips are down of our flagship policy of health and social care integration. Protect the NHS. Well, that worked out well, didn't it? You know, the NHS was indeed protected, but it is not the job of citizens to protect the institutions that were set up to serve them. It is the other way round. And while people like me have been complaining for years about this kind of casual addition of and social care to everything that was about the NHS, you know, during COVID, I think it would have been really, really, really good to say protect the NHS and social care, but it didn't seem to enter anybody's head to do that. And we have yet to discover, I think, the full facts of the actual real-time interplay between health and social care in the context of COVID, especially when it comes to care homes for older people. But by the time the public inquiry kicks off, I think we'll have a pretty good idea. I don't think it's going to look very pretty. Point 4, very briefly, we have learned how important digital technology is, you know, and how. I won't go on about this because it's obvious, but it's both for us, people who are kind of indulging in strategic discussions about this kind of stuff through Zoom, but mostly for those at the sharp end who have harnessed digital technology to be able to maintain contact and maintain support for the people they work with. And that has been incredible and transformational. It's happened very, very rapidly. Last point, because I know I'm running out of time, is that the learning is not over yet. We are still learning, I think, how far down the pecking order older people and disabled people are. You know, many, many congratulations to Inclusion Scotland for securing a place on the review panel for someone with experience of using social care support. For me, it was absolutely inconceivable that a fundamental review of social care should be conducted without anybody on the advisory panel who relies on social care, but there we are. So that's now been corrected, and all credit to the chair of the review for arranging that. I mean, you might say, building on what Bill said, you know, that it is equally inconceivable that there isn't anybody there with any expertise in commissioning, planning or delivering social care either. I mean, just imagine if there was a fundamental review of the NHS, didn't have any doctors in it, you would hear the screaming halfway around the globe. But I'll let that pass for the moment. And despite, you know, £100 million having been committed by the Scottish Government to keep the social care show on the road, we've heard already from Shubhanna and Danielle, there are huge numbers of disabled people and family carers who were left completely high and dry, and they still are. So we need to get a lot more accountability in the system for use of resources. So one final point on where older people sit in the order of things, particularly, and I declare an interest here because I am increasingly consumed by rage and by grief about what is happening to people who live in care homes. My mum's in a care home, she can be 92 on Friday. 92. I won't be there, and neither will anybody else apart from one member of her family, because that's all she's allowed to see at a distance of 2 meters outside wearing a mask. Meanwhile, the staff and the management come and go, and so do the deliveries, and so do the tradespeople, and so do the inspectors. There is absolutely no evidence to suggest that family carers brought COVID into care homes, but they are the only people who are still excluded. So this is an absolute scandal. It's an absolute outrage. The silence from people who ought to be saying a lot about this is deafening, and it can't go on. So that's me, Penny. My mum's 92 on Friday. I don't know if she'll make 93. I think that's a really, really serious issue.
Yeah, thank you so much, Annie. And, you know, often during these discussions, I find myself moved to the point almost of tears. It happened yesterday. It has happened again this morning. Thank you, I think. Now, last but by no means least, Dr. Donald Macaskill.
Thanks, Penny. We've been asked to reflect and also to look forward, and I completely agree with everything that everybody else has said. But I do a lot of reflecting, and this week particularly so because I've got to give parliamentary evidence on the experience of the care home sector in particular around COVID to a Westminster committee. And I keep a diary, and I have filled in the space of the last several months 12 thick diaries of reflection, comments after meetings and discussions, and I've been reading those in preparation because the memory's not as good as it used to be. And what those pages have been filled with have been aching sadness as I've reflected and heard the stories of tens of hundreds of people who have lost their lives during the pandemic. And I don't think we can reflect on the future without remembering the present pain, which Annie articulates and encapsulates in her own story, but which is the experience of thousands of other women and men and families and children across the country. And I go through stages of real anger and real emotion, because this is not something that you watch from the outside. For those of us involved in social care at whatever level, this has been our lived experience, whether as family, as friend, as worker, advocate, as professional. So, you know, to mix two phrases, a people who forget the past cannot have a vision of the future. And those who think that in the space of 4 months they can potentially engage with, understand, and listen to the pain of the period that we've just experienced and the sense of injustice of the period before that, I really think they're setting themselves up to a very tall order, if not an impossible task. But I think we've all heard and we all know what needs to change. We need there to be a realization that care is distinctive from a clinical medical approach to healthcare. We need to move beyond sound bites without substance, like a national care service, articulated by politicians who have washed their hands and walked away from the challenges of social care and social work through periods of austerity, but suddenly have now found articulacy and voice because the clamour from the general public has become too deafening. But they have found their voice for selfish political self-interest, and not because they have been moved by the need to change a corrupt, broken and fragile system. So yes, we clap for carers, but we don't commission care and support, as Annie said, in a way that means that we can award carers properly. Yes, we acknowledge that we have a broken system of social care support, but we don't and have not adequately resourced. And there have been some voices during the pandemic who I believe are the articulation of hypocrisy, because in their previous jobs, they were responsible for the penny pinching, which prevented people from realizing the potential of self-directed support. And now they have become champions for individual rights. So like Annie, I think there are various things I'd want to say in summary. First, that any future has to embed choice. It has to recognise that social care is distinct from emergency healthcare. Secondly, if we have new legislation, it should be about emboldening our Self-Directed Support Act, the most progressive piece of social care legislation anywhere in Europe, which we've singularly failed. Thirdly, it has to be costed in reality and not in cloud cuckoo land. If we're not going to charge people for social care at the point of need, then we need to cost that adequately. And we cannot punish people because of a particular condition which they may have. It's a scandal that somebody who has cancer will not pay for their social care support by and large, but somebody who develops dementia will probably. And lastly, whatever we do, we have to own up to the systemic discriminatory behaviour which has been part and parcel of our social care response. And inevitably, from my position, that has enabled us to excuse the lack of prioritisation of older people's care and support.
Gosh, thank you so much. That was frank, upfront, to the point. Now we're going to pick up with the comments of a fantastic 128 people that are following this discussion. And of course, there will be more when it gets posted online, but this is the chance to ask your questions. Please use the Q&A function. Either like a question that's already there or ask a new one. I'm going to go to the top of this list, and it's been liked by 6 people. And this is a question I'd like to, let's deal with the fact that we are arguably going into another series of lockdowns around Scotland. Those of us that live in Glasgow already have a partial lockdown now reimposed, yeah? This isn't going away. In the immediate future, the title of this and what we've asked you to consider is the future of social care. Let's think about the immediate future. What do we need to do to address the points that were raised by Shubhanna and Danielle, particularly about supporting the needs of people who need care and carers, unpaid carers we're talking here in this context, I think. What do we need to do immediately to, and this is from Alison, Carers West Lothian, she's asking, as we ease out of lockdown or face new spikes in cases, the fatigue and emotional and physical exhaustion that Shubhanna mentions impacts on mental health and well-being of carers and disabled adults. How do we support them? I mean, we're talking in the next few days and or weeks. Shubhanna, I'd like to come to you first on that one.
I think some of the points made by Annie and Donald there, I think we need to get back to ensuring people have control, choice and autonomy over their own care. And how do we do that? We do that by ensuring that self-directed support is implemented in the way that it was always intended. If we had got that bit right, I am pretty sure that we would not be in the situation that we are in right now during lockdown. We saw that particularly with people who have care packages. So we've been hearing this whole sort of rhetoric about, there's no funding, there's no resources. And yes, that is part of the issue, but it's not the full story, because right now, if you look at people who are who were in lockdown, who had care budgets, there were people sitting with 5, 10, 15, 20 grand in their budget, and they were unable to touch that money, okay? So the money was there, so there wasn't an issue about resources. What wasn't there was the fact that these people were not allowed to use money that they were assessed, their needs had been assessed prior to this. They were given the money, but they were not allowed to use that money to buy the support that they needed, or alternative support or equipment or whatever.
Why, Shubhanna? Do we know why they've been denied the right to do that? Take a guess.
Well, it's about. I think if this is about being honest, from where I'm standing, this was about local authorities trying to make some savings, at the cost of other people's well-being and their lives. If I'm being perfectly honest, that's
I'm glad you are, and thank you for that, because it's incredibly refreshing to hear. Thank you, and we'll look after you. Nobody's gonna, you won't suffer any backlash, don't worry. I'd like to go to Danielle on that one, because Danielle, I heard you very strongly there talking about what you buy with your self-directed support, and it keeps you going personally, as a businesswoman, and in every possible way. Is that right?
Yeah, if I'm honest, it's been my work support, especially, that's kept me going, because I've been able to have that support to work from home, to be able to provide the services through your options understood. And also because I employ PAs for technically my social support. Obviously I wasn't going out and about, but they were able to come in and sort of just help me break up the day in some aspects. But I also know from talking to my other care provider that they provide social support for a lot of people. And during lockdown, they would often say, "Oh, respite's been cancelled. We're only doing personal care, making sure people have got the meals and stuff," which I totally understand. We're in a pandemic, and it was unprecedented, and we were just trying to find a way through that. But for me, I had a worry for other people, where I was like, okay, I get that people were in lockdown and people couldn't go out and about, but who is the one to decide that people couldn't have the social support, whether it be somebody coming in and having a cup of tea with them, or watching a film with them, to help them with their mental health, like it's just been discussed as well, because that's so important, as well as personal care and essential care. So who actually decides that is more important than that bit of somebody's care? That really doesn't sit well with me.
Thank you very much. Bill, I'd like to come to you to pick up some issues that were raised there. Yeah. that we've had self-directed support in Scotland. It's been legislation since, anybody know? Anyway, a long time, 2002, beginning 2000, something like that. How come some local authorities still get away with blocking people from accessing it? How fair is that, Bill?
It's not fair, Penny, but there are system challenges there. It's incredibly clunky, and we haven't had the system change, the focus on outcomes and user-led processes that needs us to get away from the procurement approach that Annie spoke about earlier. And there's massive challenge in that in all the turmoil that social care has been in for the last decade, that has not been addressed properly. I think the issues that are coming up here they're about the pandemic exacerbating the problem, and they're about, as Danielle said, I think, it being such an unprecedented challenge where people didn't know what to do and they had to work out the way forward. And blanket approaches were taken that weren't about individual need. And self-directed support, and what we're talking about here, is about individual need. So shielding itself, a blanket over 150,000 people because they had a range of conditions, was a reactive approach, a safety-first approach, which we now know, because we've paused it, isn't required. And what we need is much more tailored approaches. Services should never have stopped to vulnerable people unless the pandemic and the lockdown simply meant them impossible to deliver. Vulnerable people, whether it's in their household or in groups, should always have had services continue. And as we move forward, and as we move into the winter pressures, and whatever second wave comes with that, we need to make sure that we can continue to get those tailored services to vulnerable people.
Thank you very much. I'd like to go to Donald and then Annie Gunnar-Logan. I mean, we have talked about this before, haven't we, about SDS. Donald.
Yeah, I mean, SDS was a potential game changer. I ran an SDS project when I was a child, and we had a real opportunity to change the way in which we delivered social care. I am absolutely convinced we would not have suffered the trauma of the last 6 months if SDS had been allowed to work. And I mean allowed to work, because SDS was essentially about transferring power to the citizen, giving them control over budgets, making sure that assessments were not needs focused but outcomes focused, giving autonomy and control to the individual. And the system, and behind the system there are individuals with self-interest and vested interest who refuse to allow SDS to flourish and to work. And we have to call that out for what it is.
Who was doing that and why? What was the point of doing that?
Well, of course, part of the problem was that SDS originated in a time of fiscal austerity. So on the one hand, we'd Scottish Government implementing a policy which gained widespread political support because it meant, and it sounded as if you were giving citizens control, but nobody really embedded the radical model which had been used in Australia on which our SDS model is based, which really makes the citizen the commissioner. So we had authorities like Glasgow, if we're naming names, who decided that in order for you to exercise SDS choice, then any provider had to be on a particular framework. The creativity, the radical change that SDS offered was destroyed by the professional system, which was about keeping control local, keeping power in-house, and failing to enable the creativity of the third and the independent sector. It was under-resourced, undervalued, and that has had a consequence in that if you remove people from being in control, as SDS professionally offered, then the consequences can be quite damning.
Annie Gunnar-Logan, so self-interest of some organisations or people within those organisations or even staff groups within those organisations have taken precedence, says Donna Macaskill. Would you agree?
It's hard to escape that conclusion, I have to say. And I mean, it is very, very difficult for organisations with power to give it up. You know, I mean, we all know that, and we're probably all guilty of that. I mean, the thing that really interests me about this is that we've now set up a national review a fundamental review of social care to look for a solution before we've actually even implemented the last fundamental review of social care, which the answer to which was self-directed support. And it was 2013 that the legislation went through, cross-party support, everybody loved it. This was the way forward. It was part of a strategy that had been going on for the best part of a decade prior to that. But you know, where is that now? Where is that? We've got another process set up now to find a different answer, and we never even asked for the first one. But just to go back to your point right at the beginning of this question, Pennie, about, you know, how do we make sure that if there is a second spike, that unpaid carers and families and people who rely on care aren't abandoned in the way that they were at the beginning. You know, well, there's been £100 million committed to keep social care on the road. Where has it gone? What's it been spent on? 75 million of it has been released. I don't know where it's gone. Some of it is starting to trickle through now to compensate some providers for the additional costs that they had to incur, you know, on things like extra PPE and extra staff costs and whatever. But I have no idea where the rest of it's gone. And I think we need to have that question answered urgently, because that money was for social care, and I don't know where it's gone. The only other thing I'd say, I mean, absolutely agree with what Shubhanna's saying about everybody being completely exhausted. You know, I think that also goes for the workforce. And, you know, they've gone absolutely above and beyond, and people are beyond exhausted at this point because, you know, I don't know about anybody else, but certainly in the third sector, you know, it's not slowed down any. We are still in the crisis response here. We are still knocking our pans in and day out. And then you have a review announced, you know, one of the central premises of which apparently is questioning whether we all ought to be doing this at all. You know, possibly should it all be taken in-house? You know, is there any place for the third and independent sector? And I just think that is the most outrageous slap in the face for these people who have been absolutely busting a gut to keep this show on the road for 6 months. And I'm, you know, I think people are kind of quite rightly angry about that, to be honest.
I mean, obviously, there's clearly some people who, yeah, for whom taking everything back into local authority control would be the right answer.
And some people have been very, very vocal about that. They find themselves in quite significant positions in relation to this review.
I mean, some of us remember what that was like prior to a more collaborative approach, but hey, what... We're hearing I'm getting some really interesting comments about structures here, right? IJBs, we have such a complicated environment to work within. Health and social care partnerships, otherwise known as HSCPs, integrated joint boards, otherwise known as IJBs. Several people have referred to integration, and I think actually it was Bill who pointed out that integration was meant to fix this. Lots of people are asking us, what do we do about the institutional barriers that we've heard so eloquently described by Danielle and Shubhanna when you hit them? Bill, what do we do about that? Have we really got to sort out the structures that underpin this?
It isn't all about structures, Pennie, but structures can hinder.
Yeah.
And certainly having two separate bodies responsible for decision making about how an integrated service is provided, how health and social care provided, doesn't make sense. The important thing is the experience of the service user, of the unpaid carer, is, to use the jargon, seamless. Structures can help with that, but two different bodies trying to do it. I mean, back when I used to do this as a day job, we used to have meetings at breakfast and lunch and dinner to try and hold things together across the health board and the social work department. And we often couldn't march in the same direction, never mind make the same decisions. However, how moving from two bodies to three bodies which we have with IJBs, made any sense, I never understood. Now, in my authority in the Highlands, as you know, we took a different approach. We went for a single body to manage services for adults and a single body to manage services for children.
And
that isn't without.
What have the outcomes been of that?
Well, I'm not there now, and that's probably for people who are there now and for the people experience. I'm not going to go into the nitty-gritty.
Is it working better? That's my question.
I believe it works better. It isn't without challenge.
Yeah.
I also believe the IJBs are a step in the right direction. I think that Annie is right, that the lead agency model involved people having to give up massive budgets and massive power. And it was a step too far for most of Scotland in 2014 and 2016. But I think the experience of IJBs and perhaps the experience of the review will take us further forward. And I don't think the IJBs are the end of the story. I hope they're not.
Thank you. I mean, back to Danielle and Shubhanna as people who represent carers and people who use services. Do you understand the structures behind the decisions that are made or not made that affect your lives? Danielle? You're on mute.
Sorry.
It's okay.
In a word, no, I don't always understand it. And sometimes on a personal level, I'll ask the question myself. And then obviously when I'm supporting other people, I'll ask it for them. But I think it very much depends what local authority people are under sometimes and what approach that they're taking. Because obviously on a personal level, I'm under one local authority, but then I'll go and support somebody else in a review and they're under another local authority. And obviously it's not about me, I'm there to support that person. But when I listen to what they're being advised, I can't help but think, but that's not how my local authority do it. And you know, it's just sometimes you come away with more questions than answers, to be fair. And somebody else picked up the point earlier about the blanket approach, and that's so wrong on so many levels because everybody's individual. But in terms of like SDS, that's where the problem lies, because every local authority implements it so differently and they interpret it so differently. So that's where a lot of the confusion lies for me, and I often say that needs to be, that's one of the main things that need to be addressed.
So you'd have a national standard on that. So
well, it's supposed to be
provision. Yeah.
But it's not the case in reality.
Aye. Thank you very much. Shubhanna, we've got a question here that I wonder whether, I think it's linked to this. It's from Alison in Carers West Lothian. It says, how can the social care review, I mean, we're talking about the future of social care, not necessarily that which is going to be considered by the social care review, but let's include this. How can the social care review create more accountability and transparency for how HSCPs, health and social care partnerships, are supporting communities? How can, the transparency around these decisions, do you think that is a way of, levering some power for people like you in this? Shubhanna?
I have no idea.
Okay, cool. I suppose what I'm hearing Bill Alexander saying is, do we need IJBs? Donald Macaskill, should we be looking at changing the way we do this right across the board?
Can I just add something there? Probably not answering the question that you're asking, but just in terms of, I suppose, full disclosure, I am a carer rep on an integration joint board. So the question that you asked, Danielle, do we understand the structures?
Yeah.
I suppose in theory, I guess I have to say, yes, I do understand the structures, but I don't necessarily think they are the right structures in terms of what needs to change. So IJBs, I think, Bill, you're absolutely right. We do need, I think integration joint board, health and social care partnership in itself, is it a good thing? overall, I'm going to sit on the yes fence for the moment. But again, with everything else that we've talked about, it's the issues around how it was implemented and how it was rolled out and how that vision was rolled out. People were sold a vision of integration. Nobody actually, and this is quite interesting because I think we're having the same conversations about a national care system. I know we're going off in a different direction here, but right now people are being sold a vision of a national care system. And I think I heard at a previous session, and I think it might have been the one that you were at, Annie, where people talked about we don't need to be talking about the nuts and bolts of it right now. We just need to all go with the vision. I fully disagree, because I think that's the problem that we had with integration. We were led, we were given a vision, we were not given the nuts and bolts, and now we're all sitting there, you know, with our nuts and bolts and thinking, goodness, how do we fit all these parts together? And some of these parts don't fit, and you know, there's the missing pieces as well, and people are saying, well, this isn't the vision that you sold as well. Do you know, we should have been a bit more clear right at the start. It's the same issues we're having with the national care system. We didn't really think through the nuts and bolts of integration joint boards, and which is why I think partly we have got some of the issues we've got right now, just in terms of how do we ensure that the voices of carers and people with support needs are heard? That absolutely needs to change, because part of the integration, part of the role of the health and social care partnerships was to ensure that the voices of carers and people with support needs are heard. Yes, we do sit on those boards. Are our voices heard? Probably not so much, for a number of reasons.
Do you have voting rights on those boards, or are you there just to witness what they do?
And I think that's probably another contentious issue. We don't have voting rights, but I suppose the point is, do we need voting rights? Which is a whole other conversation, I think.
Okay, well, let's get into it. Annie Gunnar Logan, do we need voting rights for people?
Look, integration of health and social care is a great idea. Everybody agrees with that. Nobody disagrees with it. It's fantastic. But the reason why it had to happen was because these two bodies were at loggerheads with each other, okay? So you had the council on the one side and you had the NHS on the other, who kind of couldn't get on, couldn't work together, and so they had a gun put to their heads and they were told to get on with it. But actually what the IJB does is it simply recreates exactly the same conditions again, because you have equal numbers of NHS people on a board and equal numbers of council people on a board, and they all have voting rights and everybody else doesn't get any. So, you know, my view of this, which I shared very much with the Alliance right at the beginning of this, was if those two kind of, you know, warring partners actually had to make a pitch to the range of other people who were there in order to persuade them and produce evidence that their plans for expenditure were the right ones, and then everybody got a vote, we might see a very different kind of landscape emerging. And I mean, I think one of the really big difficulties with integration is that it was all done and dusted without actually paying attention to the structural fault lines that remain between the two bodies. One being self-directed support applies to social care, doesn't apply to health. The other being that social care is a market and health is not. And the other being that citizens have to pay for social care, they don't have to pay for the NHS. Now, you know, you can bring those bodies together and you can call it integration, but unless you were going to sort out any of that right up front, you were kind of on a hiding to nothing. And that seems to be what is now emerging. And I think that's really problematic. But there's a little bit of a chat in the Q&As there from somebody, is it Sandra, saying, you know, how do we avoid the review of care becoming entirely focused on structures? And yes, Sandra, please, let's not do that again. A colleague from Scottish Government reminded me the other day that when there was a fundamental review of justice and everybody was saying, you know, well, victims must be at the heart of the review, you know, well, offenders must be at the heart of the review, the judiciary must be at the heart of the review. No, justice had to be at the heart of the review. So if we're going to review care has to be at the heart of the review, you know, not the local authorities, not the third sector, nobody else. That, you know, absolutely focus on what matters here. Otherwise, we're just going to repeat the mistakes. You know, what do they say? History repeats itself, first as farce and second as tragedy. You know? Let's not go there again, please.
Donald, do you agree with that?
Absolutely. Both Shubhanna and Annie are absolutely right. I think one of the problems of the last 6 months that have led to this desire to create a review is that we've seen a diminution in the value being given to social care and an increased medicalisation and approach to social care which sees it as an extension of clinical service. So I really worry about what might happen if that continues, because Annie's right, social care is different. What needs to happen in this review is that we put care at the centre, and all the themes of autonomy, individual human rights, living life to your fullest potential, of independent living, the voice of the person being at the centre of all decision making, etc. That's not the health system, let's be honest. That is the essence of good social care. And I worry that we'll get so caught up with the structures that we'll lose sight of that. And for me, that has to be about keeping care at the essence, not the structure.
Okay, and that's going to be a big challenge for the review, with the different competing interests that are going to be lobbying it hard. Here's a submission by an anonymous attendee who says, I would be interested to know how the learning from models of integrated care delivery, example Buurtzorg, and neighbourhood care, there isn't time to go into explaining that, but basically different care models, community-based care models, can be used to plan how care should and could be delivered in the future. The models have merit, but all too often the barriers are reached at middle management level, says this anonymous attendee, in terms of control of budgets, etc. COVID relaxed this momentarily. How do we keep this ethos going forward when we keep hearing people saying they want to return to some kind of old normal? Donald Macaskill.
Yeah, and you know, for me, Buurtzorg has become a little bit of a swear word because it almost felt like we had a politician who went on a wee tour of a country. He saw a project that worked and thought, oh, that's good. So we then paid for those people to come up and tell us what we knew already, which was that good care happens at community level. Good care happens if you adequately resource the worker and if you adequately give value and autonomy and the ability for professionals to exercise their professional judgment. We don't need another model from Holland or, dare I say, even from Sweden. We need to build on the capacity and the models that we have here. And critically, Buurtzorg would only work in Scotland if we realised that a Buurtzorg nurse is better paid than an acute hospital nurse in Holland. We never value social care workers to that extent. We pay them the minimum wage, and then we moan, if we're a politician, that these nasty third and independent sector providers are not giving decent terms and conditions. Enough political hypocrisy. Start putting people at the centre and get real that we've got the solutions. We don't need to look beyond Scotland for them.
Oh, enough political hypocrisy. Shubhanna, you're clapping there. You agree with that sentiment, yeah?
Sorry, yeah, absolutely. I think it's a point that I think many of us have made. The solutions to our problems lie within our communities. They lie within us, you know. And I think there's that whole sense, you know. I think somebody once said to me, "Service." The definition of service land is somewhere where good ideas go to die. You know, it's people know what they want, and often, you know, we know how to meet our unmet needs, and often what happens is, you know, it will, I think what Annie was saying, it will get packaged and commissioned into something that doesn't resemble what we need, and it's just nonsense.
Well, here's a really good contribution from Maureen O'Neill saying, it's clear that systems do not work, that integration is unequal, that individuals with experience aren't included. How do we stop talking about the issues and the promises, but actually develop integrated systems for the long term, not just for the space of an administration? As individuals, we need to know what the reality is for us and who takes responsibility. Anybody want to pick that up? I mean, basically, people sometimes talk in terms of the NHS about taking the politics out of it. Is that possible, Bill Alexander? Do you think we can come up with a cohesive, non-political, long-term answer to these challenges that isn't embedded in the politics of it all?
I think we can, and in fact, we've done it in Scotland in services for children. because apart from some of the lunatic fringe in Scotland, we've been committed to getting it right for every child since 2005. And it started with Labour and the Lib Dems, and it's now the SNP government, and I do believe it continues to have that political support. But that does evidence that you have to play it for the long game. You can't do it within a political administration. It is about working through generations. It is about sticking at it, even when it becomes difficult. It is about recognizing you can't do everything in structures. You simply can't do everything in legislation either. You have to do it in terms of frontline practice. And I wish we had a getting it right for every adult in Scotland, where we actually understood who organised their care, who coordinated their care, and who they could get help from.
Would that be so hard to do, Danielle? You're on mute, Danielle, are you?
Sorry, what was the question?
Yeah, basically, you know, that if we had an approach to adult social care as we do to children's care in Scotland, and we put, you know, everybody at the centre of decision making, genuinely, that would be transformative. But is it possible?
It is possible, but I think I've had it said to me in the past by an organisation. They said, we're frightened when people like you come along, Danielle, because you'll tell us we're doing it wrong. And I said, well, yeah, I'll tell you you're doing it wrong, but I'll do it constructively so that we can work together to improve it. And I think it is a lot about fear. And, like, for example, I use rebranded. I've got a new tagline that says, what do I know? I only live it. So for me, that sums it up, because this is my reality. And for a lot of people on this discussion, they work with people that is a reality, or they're living it themselves. So I think we need to get away from that fear and always like devaluing disabled people, because during lockdown I received a phone call which concerned me, and it was about, I don't blame my care provider because they were just following instruction, I guess, but it was about, did I want do not resuscitate order, and or did I have one in place? And I was sitting at home on week whatever it was of lockdown, and I'm able to express that, but they didn't know what my mental health was like. They didn't know, so I could have agreed to anything. So I didn't, because I wouldn't. But there's a risk there, like you could phone people when you don't know what's going on for them at that time. So, but even that approach to, I get why you would ask it, but then were non-disabled people asked if they caught COVID-19, would they want to not resuscitate? Probably not, unless they had other health conditions to consider. So we need to move away from that, because you have CP, but because you have CP or whatever, your contribution or your life is any less value to the person next to you. We're the ones that live it. If you want to improve this, then don't be frightened to engage with us. We might tell you the harsh reality, but this is the only way it's going to improve.
It's what it's for, isn't it? For involvement. Here's a question from Jill Dixon that relates to human rights, Donald. We're hearing more and more discussion about human rights and how they apply in a social care context or in a care context. And I think, I think I can speak for several people in saying that sometimes it's hard to understand what that means. Now, here's a question. Setbacks in the equality and human rights landscape have been a casualty of COVID, says Jill Dixon. For example, disabled workers are struggling to return to the workplace safely. How can any review reframe equality and rights considerations that are not just lip service, but meaningfully talk about the rights of all people? Jill's worried that the review will be of services and not principles. Do you think we need people to understand what human rights means for them in this context? Donald?
Absolutely. And, in December, I wrote a piece arguing that social care was a human right and why it was a human right. And I wrote just before the start of the pandemic that Scotland would be judged on the way in which we responded in the pandemic as to whether or not we were an equal or discriminatory society. Everything I have seen in this pandemic response has confirmed for me that we talk the talk of human rights but fail to walk the walk, and that we are an increasingly discriminatory society. Danielle's issuing of DNA CPR, the clinical abandonment of older people in care homes as primary care rushed for protection, the failure to allow voice and the ability of residents to be heard 25 weeks after lockdown starts. I could go on. We have massively embedded a discriminatory second-class citizen approach to so many individuals, whether they have disabilities, whether they are of older years, in our pandemic response. And I have no confidence that any approach in the next few weeks will address those discriminatory, systemic issues of human rights abuse.
Thank you. Annie, there's a comment here from Alison Reed, who's saying that her mum is 89 and in a care home, and talking about the same issues that you've identified with your mother. That's a human rights issue, is it not?
Well, I think it's a human rights abuse, actually, what's happening at the moment. You have a human right to a family life. And your family are the only people left in care homes who are not actually allowed to see you. Again, where is the Minister for Older People and Equalities and Rights? Where are these people? Why are they so quiet about this? But Pennie, this isn't new. I would want to refer listeners back to a document which is called the Statement of Ambition for Social Care Support. It was produced by the Independent Living Project that was part of Inclusion Scotland at the time, and that was incredibly articulate about all of this, and it explained precisely why this is a human rights issue. Because people who have particular challenges in their lives, whether that's about impairments or whether that's about addictions or whatever it is, those people will struggle to participate as full citizens and to be able to express all the rights that they have without social care support. Even something as basic as if you cannot get out of bed on your own, how on earth are you ever going to exercise your rights as a citizen? So if you kind of frame it in that way, it begins to make perfect sense. But that document is already years old. All these decision makers who are lining up to lead this review, they've had all of that. People have sat down and talked them through this, in absolutely minute detail with masses of evidence. We all have. We have all done it for years and years and years. So this absolutely has to be different. And I like whoever just said, this cannot be about structures, this review, and it cannot be about services. It has to be about principles, and it has to be about care and support. That's what I hope to see.
Here's it's a question that's actually come through on the chat, but I think it's quite an interesting one. We're sort of running out with, we've got so much to talk about, but we're coming to the end of a session now. So Wendy Johnson is asking in the wrong forum, but never mind, we'll let her off with that. How do panelists suggest we engage with media and influencers to increase support for investment, including from taxation, to develop a caring society which represents individuals of all ages? Actually, there's a question before that, which is, do you think, as individuals on this panel, that this is going to need more investment? Does this need more money? Shubhanna, I'm going to come to you first.
So more money is always a good thing. But it's, okay, let's go for more money, but also let's try and think about how that money and how that extra funding is actually used, because I think that has always been the sticking point. We can keep shoveling money into the same hole and we'll get nowhere. What we need to think about is where is that money actually needed, and what's the best use of that funding? And that's the bit I think that people either can't get their heads round or are not willing to get their heads round. So yes, so more money is good, but we need to be very clear about what we need it for and where it's needed, and the benefits that it will actually have.
Thank you so much. I don't know if anybody else wants to pick that up. I mean, for instance, Bill, do you think it's going to need more investment?
Well, more investment is always good, Penny, and how we pay for whatever the outcomes of the social care review are is obviously perhaps the biggest challenge. But I think you've hit on a key issue, which is about how we help society, never mind politicians, society understand these issues. You might help us with that in terms of the media, because I think we failed collectively in terms of helping society understand this and the media. So let's focus on older people.
Yeah, and Danielle, somebody talked about the language as well. I think it was Bill, wasn't it? Sorry to interrupt you, Bill. Did you want to carry on there?
Yeah, can I just say, I think we've got a massive challenge in terms of older people who are an asset in our society. But the fact that we have more older people currently and increasing numbers of older people with a reducing base of working age people to work in services and to pay taxes to keep services going is not understood. So the media talks about people getting older. Mm-hmm. People aren't getting older. In fact, in some communities, they're getting younger. The challenge is more people. How do we fund it and how do we resource it? I believe if we had communicated that, we probably wouldn't have Brexit. People would have understood what a stupid idea it is. The reality is it's unsustainable just now. And we haven't managed to communicate that fundamental fact.
Yeah, thank you. Annie, you wanted to come in there.
Yeah, I mean, let's just put our cards on the table here. If one of the outcomes that we are seeking here, which a lot of people have talked about, is better pay and terms and conditions for the social care workforce, then of course it's going to cost more money. It's going to cost astronomically more money than it does at the moment. And so if we're not actually prepared to put that money up, then I don't know why people are even bothering to talk about it, because it's going to be phenomenally expensive. But if there is no more money, Penny, then what we have to do is we have to try and manage that in a different way than expecting people to fight to the death for it, which is what we do at the moment. You know, we make people compete, we make people scrap, we have different interest groups, you know, saying, well, the more money for this group, more money for that group. You make the voluntary sector tear each other to pieces over it, and it's absolutely ridiculous, because that is what has got us into the position where we need a review in the first place, you know. So if we were able to have sensible conversations with people who use support and their families and their carers, you know, here's the limit of what we've got. What is the best way of using that for you? That happens all the time in the third sector. That's what the third sector does. So again, I come back to my point about look at who's doing this. Look at who's doing this well. Look at who understands these things, and then support them to do more of it. And then you don't need to get into arguments about changing structures at all, because we could actually work within that now.
Thank you. Donald, you wanted to come in there, yeah?
Yeah, and I agree with Annie and Bill. Of course, we will need more money to create greater equality. But if we look at the way in which we spend resource at the moment, what that shows is discriminatory exclusion. So we pay £2,900 a week to keep somebody in hospital with no treatment and care, and yet we only pay £700 a week to give them 24/7 nursing support and care in the community. You know, we pay 3 times as much to support an individual under the age of 18 in residential care compared to a person over 65 in residential care. So the way we spend our money, we make decisions around the value we give to an individual. So you're right, Penny, we need to change the dialogue in the public sphere as well as the political sphere, so that we value the contribution of older age. The age is not seen as having a sell-by date in terms of contribution. We are, I am afraid, more age discriminatory at the end, we're not at the end, in the middle of this pandemic, than we ever were before. And that's been perpetuated by the media, which have used narratives such as, this is only a baby boomer's curse, don't worry, you're not over 70, so you don't need to worry. The level of age discrimination in the popular and public media during the pandemic has been obscene, and that has filtered into the general consciousness.
Thank you very much. Now we're going to ask a last question here. Apologies, we've run out of time, guys, but here is a question from Claire Cairns, and it gets the most ticks on our list of questions. What do you, as individuals, I'm going to ask everybody the same question, want to come out of the review of adult social care? Claire says, particularly in relation to the role of the third sector in providing social care, but I'm going to leave it to you. What would be, for you, the most important outcome of the review of adult social care? And I mean, I think they're due to report first off in January, right? So they haven't got long. So if you wanted to get a message through, and again, I'm going to start with Danielle.
I think for me it would be, I would pick up on the point about financial views that have already been shared. They can throw as much money at it as they like, but it's all about engaging with the right people and the people that actually live this. And I don't just mean myself as individuals, I mean people that care for people with disabilities or health conditions. And I think it's like what sort of concerns me as well is that some like care providers and things seem to think that this is over, and it's really not over. So I had a conversation the other day about somebody had said that the rota was really busy, and I said, but what's going to happen if you have a track and trace? The provider then is going to be snookered because everybody's going to have to self-isolate and things, so nobody knows when this is going to be over. And I know the care reviews happening now, but we need to acknowledge that we might be in the middle stages, Donna said, but we're not at the end. So we need to think about this, unfortunately, for a lot of us in the longer term, and making sure that the support is there for people as we go through. And we might not know what that looks like, but we need to be thinking about that.
Thank you very much. And Shubhanna, I think at that point that Danielle's made there, we've got long-term considerations. We've also got really short-term considerations to address, and there have been a few questions on that. What, Shubhanna, would you like to see come out of any adult social care review?
So I realise this is probably not going to happen, but if we're being honest here, what I would like to see come out of this review is actually something absolutely honest and radical in the true sense. You know, that is what would actually make me think and forgive them for having such a short timescale for this review. If they, at the end of those 4 months, came up with something that was extremely honest and extremely radical, I'd be like, do you know what? Well done. And what do we mean by radical? I think by being radical, being honest. And I think Annie and Donald have already said some of the people sitting on that review board, they're not, they know what the issues are. Most of them do, because they're experts in that area. You know, so some of the information that they are going to find is not going to be new information. It's about whether they are able to be radical enough to point to the right solutions. And what are some of those right solutions? Well, I think some of those right solutions are around considering whether local authorities are the right body to be managing, assessing and delivering social care. You know, that is hugely radical. Are we going to get that? Probably not. But, you know, we're talking about what we would like to see. That is what I'd like to see. And I think Claire's point around where the third sector sit in that, actually, are the third sector better positioned to be delivering delivering like social care completely. And I think I just want to come back to a point that Bill made at the start, which I wholeheartedly agree with, is social workers are not the villains in this. And I think sometimes, unfortunately, they do get painted in a bad light. Social workers are absolutely some of the best and funniest human beings that I have never met in my entire life. And it's a shame, because I don't think the majority of social workers want to be working in that structure. Unfortunately, they have to, because that is the way legislation and the system is set up. If there was, and I know there has been talk about, and again, it's a very airy-fairy talk about this National Social Care Agency model. But if social workers were completely separate from local authorities, imagine what a world that would be.
Thank you very much. That segues into you, Bill Alexander. So, yeah, Shubhanna's comments there, but your own, what would you like to see out of the review?
Thanks, Penny, and thanks to everyone for a really engaging discussion. I'd like to see a practice model that gets service to adults, that's based on what works, that builds on the multi-sector model and the diversity we have in Scotland, that allows a 6-bedded unit in the northwest coast of Sutherland and a 100-bed unit, if that's what makes sense, in the centre of Glasgow, but critically that puts the individual at the centre with the right support that they need to achieve the outcomes that will allow them to retain their dignity and to continue to achieve their potential for as long as possible.
Thank you. And Donald Macaskill, what do you want to see?
Very much agree with just what Bill has said there. I hope the review comes out with a sense of really having listened to people, and not just the loudest individuals, but to really have got beneath the real pain and distress and the emptiness of the last 6 months, and to, in so doing, give space and recognise that it may not come up with all the answers, but that it's the beginning of a conversation. But Bill is absolutely right. This is to put people at the centre, to build any system and structure, any change in legislation around the person, not the workforce, not the provider, not the local authorities or any other system. That would be my aspiration. And I would also probably say to realise that we are a small nation and we don't need to try to be other than we are, which is a community of people, rather than seek to be something that we're not.
Thank you so much. And the final word goes to Annie Gunnar-Logan.
Thank you. Well, my list of what I want the review to do is very, very, very long. So you challenged me to say what is the kind of single most important thing.
What one?
I think that the single most important thing that I want the review to do is to result in a complete stop to the policy and the practice of parcelling people up with support needs into lots to be tendered, and expect organisations to bid for those lots in a market dominated by price to the extent where the whole thing becomes unsustainable, because that's where we are now. And that is what COVID has exposed. And that needs to stop above all else. People are not lots. People are not commodities, and we need to stop treating them as if they are.
Now, I don't know about you, but I could talk about this for several more hours. However, we have reached a natural end to the discussion. I'm sorry if we didn't get round to answering every point that's been raised, but believe me, they've been read, they've been taken in, and they will influence people's thinking for some time to come. I'd like to thank very, very much, please, Shubhanna, Hussain-Ahmed, Dr. Danielle Farrel, Bill Alexander, Donald Macaskill and Annie Gunnar-Logan, and also all the wonderful people who have participated remotely in this debate. Thank you very much and good luck.
Thank you, Pennie.
Thank you.